We have the addition of work requirements for Medicaid starting in 2027. We have ACA tax credits expiring this year, which I brought up, that are going to lead to, on average, a 21.2% increase in insurance costs next year, which is really great. Hospitals are absolutely already closing. Our estimated number is about 250 to 500,000 people will lose Medicaid, and another 200,000 people will be priced out of ACA plans. Our at-risk hospitals are mostly in the Columbia River Valley, with some on the Olympic Peninsula as well. But we have more than just these at risk. These were just the federally acknowledged at-risk ones because they provide a ton of Medicaid patients, a high percentage of Medicaid patients. A 2% increase in copays resulted in a 10% reduction in usage. This was a study ran back in 2006. I know copays have gone up a lot. I know I used to pay like a $20 copay, and now I pay a $60 copay. I know inflation is at 3x over that 10-year period, but that's the way it is. Our mission at Whole Washington, something that it would be very hard for us to budge on, is zero out-of-pocket spending for people going to the doctor. And we do not like copays. Why do we need Medicare or Medicaid? Why not just Medicare or Whole Washington? We need their money. Uh, as it stands, we need $20 to $25 billion for this bill. So 20 before HR 1, roughly, and 25 after HR 1. And if we don't get any Medicaid or Medicare money, that number's bigger. And raising that money is already going to be a challenge for many, because they'll see higher taxes or whatever. So have you ever struggled with access to healthcare you needed? I imagine the answer is yes, because our system is anti-business and anti-worker. Employers provide coverage to about 55% of Americans. Health insurance runs between 6 and 22% of payroll. 6 for very low wage, very high wage workers at large companies tend to be at the very low end. So people making like $500,000 a year tend to be at the low end of that. Whereas that 22% is experienced by a larger percentage of businesses, because our small businesses are often paying a flat fee, which is a high percentage of like somebody who works at a restaurant's salary. Many small businesses can't afford to provide coverage at all. In fact, only like 29% of small businesses actually provide health insurance. And then we have regional problems where health insurance is not even offered. Employer-sponsored insurance traps workers. As we had brought up earlier by Cordero, uh, they're stuck in the job that they don't like because they need to keep their insurance. Like that's an extremely common experience. Uh, there are a lot of problems where you lose your job, you get laid off. There's been a lot of layoffs in the Seattle area, and you lose your health care regardless of the reason. And during COVID, this is a particularly large problem. Universal healthcare is better for unions. We have a lot of exciting updates from this year about our involvement with unions, but really unions are coming on board with single payer healthcare, and it's really been an exciting 6 months on that front. While it's been a very demoralizing 6 months when you consider the federal government. And the reason why this happened is the Washington State Labor Council on July 24th passed a resolution in favor of single-payer healthcare. It's the strongest resolution that they've ever put out in favor of universal healthcare. Over 300 labor delegates voted. Only one group abstained. There were only a few cards raised in opposition. And we're actually talking to those groups, and many more unions are actually sending out links and advertisements to our movement for universal healthcare in their materials. How much would a small business have to pay? We'll get to that soon, and that was actually a topic that we talked about quite a bit today. I had some meetings with some other folks, so I'll get there shortly. Our healthcare system is unfair and perpetuates inequality. I really the more rural areas of our state have higher Medicaid usage. You can see from this graph that our central area, our eastern area, and every area that isn't King County or downtown or the east side, being the east side, like Redmond, Bellevue, it is really high in Medicaid usage. And one of the more demoralizing statistics to look at is that poor women live 10 years less long than rich women, and a huge part of this is access to healthcare. And for men, it's even worse. It's close to 15 years. We need to address this. Uh, Really interesting graph that's very confusing. I apologize for this. I'll interpret a little bit. In Washington State, most Asian ethnicity people tend to have very good healthcare experiences. White, also very good. Hispanic and Black, not as good. And Native American, absolutely horrible. Like, that gap between our highest uh, achieving in terms of healthcare people and our lowest is the one of the largest gaps in the entire United States. We are really leaving our native people behind, and this is not acceptable. So, have you ever been treated unfairly by our healthcare system? My guess is yes. We've talked about a lot of stories already today where people have struggled with this. So why is it so bad? It's money in politics. It's big pharma, insurance companies. The AMA has been coming around a little bit on this, but they have been very afraid of, like, especially surgeons and high level uh, doctors like that. They don't want to lose their big payouts they're getting. And so they've been resistant to this model. I can tell you, most PCPs or general practitioners you talk to will not agree with that sentiment. They want this now. And with HR1, it's going to get worse as we go along. The amount of cuts that are projected goes up kind of linearly every year until 2034, unless we get universal health care. So, just a quick definition of universal healthcare is universal healthcare means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. And the key elements found in successful models and things we want every single one of these is everyone is eligible to enroll or is preferably automatically enrolled. There's a universal set of essential health benefits that everyone gets. Uniform billing and reimbursement, significantly publicly funded or entirely, and not for profit. This is basically the opposite of our current system. So, universal healthcare works around the world. As was brought up earlier, every other developed country in the world has more universal healthcare than the United States. We're in a category with countries like Egypt and Mongolia and the Philippines. Like, these are not usually who we see as financial or healthcare peers. uh, Universal healthcare is really popular here in the United States. Northwest Progressive Institute ran a poll. Are you willing to expand Medicare to provide universal healthcare coverage to all Americans? 2-1 in support. Economic Opportunity Institute ran polls basically gauging what Democrats and Republicans and independents, like, how happy they were with the current system. And across the board, people are unhappy with the current system. And this is not a political issue when it comes to the unhappiness with how things are going right now and whether or not our leaders should do something to fix it. And our last one is that NOLA, Northwest Health Law Advocates, did a poll, and polled people on what are the most important issues to them. And even before HR1, healthcare affordability came in at third. Just below inflation, you could probably tell when this poll was put out, and housing affordability. This is a core issue for people. So, a brief history of universal health care in Washington. In 1993, the Health Services Act was signed into law. This was during the Clinton universal health care era. And then by 1995, it was gone as Republicans took over Congress and sabotaged it. In 1999, Healthcare for All Washington ran the Washington Health Security Trust, which is the predecessor of our bill, as a ballot initiative. In 2018, Whole Washington took over the campaign and ran its first ballot initiative. In 2021, Whole Washington got the Universal Healthcare Commission put into being along with our coalition members at Healthcare as a Human Right Washington. This commission, while it's called the Universal Healthcare Commission, has not done anything really to deliver us universal healthcare, which is something we hope to improve upon. In 2022, we ran our last ballot initiative. And in 2025, our health trust was introduced into the state house for the first time. So this has been a really exciting year. Not only did we get record Senate sponsorship, but we also got it into the House. So we're now in both chambers and have two healthcare chairs to lobby instead of one. So what's the cost of inaction? This is the cost. These are all the things from that timeline, and none of them have had a material impact on our cost of healthcare. So, an example of universal healthcare being implemented quickly is Taiwan. Taiwan went from below 60% to almost 99% within a couple of years when they instituted universal healthcare. Now, Taiwan's a smaller country, but not a terrible proxy for Washington state. We can do this if they did this, and they did this very quickly and very effectively, and they have one of the best universal healthcare systems in the world now. So let's talk about our bill now. The Washington Health Trust is a universal healthcare financing bill, SB 5233 and HB 1445. You can look this up and read it online if you would like. It's a universal single payer healthcare system. The single payer comes eventually. It would take a minute to transition to where we could be single payer. Doctors and hospitals would remain private practices. Under this, we're not taking over all the hospitals. This is basically replacing the insurance companies with a state insurance entity that handles that for everybody. And other countries with similar systems are Canada, Taiwan, South Korea, and Australia. And as was brought up earlier, and we talked about, it originally passed in the Canadian province of Saskatchewan, which had a smaller population than Seattle at the time. And because it was so popular in Saskatchewan, it went all around Canada. And within 7 years, every province had some type of universal health care. We include a transition plan, and it's fully paid for through public financing. The Washington Health Trust would provide comprehensive coverage of medical, dental, vision, hearing, mental health, and reproductive care. There would be, this is very important, no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. You can learn more on our website by navigating to it or going to wholewashington.org/proposal or /FAQ. The one pager in particular here is a great resource if you just want to brush up on what our bill does. And you can find that also at wholewashington.org/print. How do hospitals feel about Whole Washington? I would say that it depends on the hospital. A lot of community health clinics really, really like what we do. And some of the hospitals that are killing it in terms of their profit margins, I'm looking at you like Franciscan Health, are not as happy about this. The Washington Health Trust is real legislation. It was based on that previous bill. It's designed to align with federal Medicare for all. It's been vetted by the Washington Employment Security Department and the Department of Revenue. It used Healthy San Francisco as a model, so we can get around ERISA requirements, which require employers to have options to private plans. Uh, we're just hoping our plan is going to be so much more attractive than any private plan that nobody will pick any of the others. And it builds on top of federal programs like the Affordable Care Act, Medicare, and Medicaid. And it would supplement and hopefully bring up the level of our Veteran Affairs and Indian Health Services. So, simplifying our healthcare system. You might know how complicated our healthcare system is right now. Our goal is that there's a trust and it pays providers. And that's kind of it. Employers pay a little tax, and some residents also pay some of that. And that's kind of it. So, how do we pay for it? This was brought up earlier. We have a payroll tax, essentially like a B&O tax, that is progressive depending on the size of the business, where smaller businesses take on a lesser burden than larger businesses. Employers may deduct 0 to 2% of that 4.5 to 10.5% from employee payroll. So this number could be look as low as for the bottom line of a business, 2.5%. But it's really complicated to assess whether or not employers will be incentivized to do this because the lower the salary of an employee, so if they cover it and just take it out of your salary, then they don't have to pay as many federal taxes on that. So I don't know exactly how that'll work out, but otherwise we have a capital gains tax. This part is very likely to change in the near future. We're getting a lot of legislative pushback on this, as well as people who want to use different progressive tax strategies, and we're hoping to come up with something that can fill that gap and cover the extra 5 billion we need to cover because of HR1. Uh, so we have some work ahead of us in terms of how we pay for it. Looking at those percentages for micro, midi, and large businesses, these are those rates. You can see micro, even for somebody making a lot of money, will pay significantly lower monthly contributions than large businesses. Sorry, what's HR1? The Big Beautiful Bill is what it's called. Uh, the big budget resolution that went through this year that cut Medicaid. Sorry, I should have defined that. I'm going to skip the capital gains since that part is not entirely stable. Here's the good news about universal healthcare, and something that I think is a great thing to lead with. The Washington Healthcare Authority did an analysis on this, and they think that we would save money even during implementation. And by the time we get all the waivers and everything set up, we would save about 7% annually. We spend about $80 billion on healthcare, and it was projected that we would spend about 74.4 billion after that. Dr. Gerald Friedman ran an analysis for us and estimated the savings at between 5 and 13 billion annually. So not only does this cover more people, but it does it significantly more efficiently, and it's cheaper overall. Universal healthcare is the only way for the state to keep people covered without costing more money. My favorite stat to throw around is 7%, roughly our unemployed or uninsured population. 7% more people covered for 7% less with better coverage for almost everybody. I think this is a fairly safe thing to say. So where does that waste come from? It's mostly administration. You can see provider administration and insurance administration are a huge part of what universal healthcare would fix. And anybody who's bought drugs in other countries, Canada, Mexico, Philippines, Europe, know that prescription drugs are just way cheaper everywhere else in the world. We get swindled here in the U.S. for our prescription drugs. And if the whole United States was one entity, our universal healthcare system was one big universal healthcare system, we'd have the power to bully the pharmaceutical companies into no longer controlling our pocketbooks. So how do we pass it? We have two strategies, really a couple more, but the first is the legislative strategy. It requires a majority vote in both the House and the Senate and a signature by the governor. That's a pretty tall order. In the Senate, we introduced it back in 2019, but we never had more than 7 co-sponsors, and we had 11 this year. And I'm hoping we'll have more next year. I think we will. And in the House, we never have had it introduced. And we honestly didn't put a lot of groundwork into getting co-sponsors for this, and we still ended up with 17, which is awesome. Next year, when we already know we have a prime sponsor for this, or really next session, we can get a ton more, but even next year, we can get more people interested. If you don't know, the sessions go odd even. So 5 and 6 are the same legislative session, and then 7 and 8 are the same one. So we're likely to reintroduce our bill uh, in 2027 at a bare minimum, but possibly also in 2026. So what's next? We really need to work on these two individuals, Dan Bernowski and Annette Cleveland. The good news is Annette Cleveland has joined the Universal Healthcare Commission, so we're going to be having a lot more back and forth with her moving forward, which I'm pretty excited about. We passed legislation this year. We passed Senate Joint Memorial 8004, which was our first enacted bill, and it means the Washington State Legislature has endorsed universal health care without any money attached to it yet, and has asked the federal government to help facilitate it. So even our legislators know that this is the right option, but the onus comes on us for them to pressure them into actually implementing it. The main impact of SJM 8004 was really increasing our political capital, putting Democrats on the record for this, and the fact that we now have Senator Cleveland on the Universal Healthcare Commission. So the other way we could pass the Washington Health Trust is the initiative strategy. We've run 3 initiatives in the past, 2018, 2021, and 2022, and we are really, really gunning to run another, and hopefully this time much more successful initiative in 2028. That's our big year for this. It's a presidential election year. It's a year that we can get a year and a half or year and a half to really set the table to be successful, have people in every county in the state, and make sure that they have the tools to reach out to their community and get this passed. And these are expensive. Basically, it costs about $1 million to make the ballot. We might be able to do it for less than that because we can get a ton of grassroots support, especially in light of the Medicaid cuts. But it's in that ballpark to make the ballot, and to win. This would likely be the most expensive campaign to run, and we'd need on the order of $25 million, maybe $30 million. The insurance companies are going to go hard against this, especially if we're the first and only state. However, I'm pretty hopeful that Oregon will be doing this alongside us, at least Oregon. So, some priorities for our end of year. So, things to do, essentially, is what I've gotten to here. We need to grow our organization. We need more volunteers, and we need basically manpower, ground power to run a successful initiative campaign in 2028. And also to reach out to all the local legislators and inform them of this bill and explain to them how it makes things better. It's cheaper, it's fairer, it's better. Oregon has something going on for sure. Yes, they're ahead of us, I would argue. We need to have a large enough donor base to have multiple employees. Right now we have 2 part-time employees, which is more than we've had in the past. So we are building up, but we need to build up further, and we need people and infrastructure everywhere. Our second is developing legislation. So something that's really exciting that's going on right now is we have a working group with our coalition, Healthcare is a Human Right Washington, and Senator Hasagawa. And our goal is to draft bills that are like partial big bills. So we have our big universal healthcare bill, and we want to split it into smaller chunks that have a better chance of passing in the near future. Something like making sure we adequately cover all minors or along those lines. This is really exciting. If you have interest in bill construction or anything like that, we can definitely get you involved. Uh, and then increasing outreach. We need to partner with more organizations, grow our coalition at Healthcare is a Human Right Washington, and grow our relationships as Whole Washington. So they look at us as like serious players here. We need to step up our game on social media. I'm the social media head, so this is my little plug here. I'm always interested in recruiting volunteers for this. And we need to work with student organizations and movements. And this is something that we also started very, very recently and have been having some success, especially at like UW, and we have somebody at Central. So anybody involved at a college, we really appreciate you. Our last one is building relationships with the legislature. We need to build out a robust legislative team, encourage more people to talk to their representatives about universal health care via letters or public testimony, and create materials designed for legislators that outline what we bring to the table. And we don't have like a clear placard for this. We have some things we've made for some meetings, but making professional material for this is something that we're working on. So, would you like to be part of the solution? If you would, the lowest tier of support you can do for us is pledging to sign our initiative. All this does is essentially put you in the database and we'll send you an email when it's time to sign the initiative. Our next tier, in my opinion, is follow us on social media. Gordon says, I enjoy your TikTok videos. Thank you. I appreciate you. My wife's laughing at me. Yeah. Oh, with me. Okay. Yeah. So we are on Facebook, Threads, Instagram, Blue Sky, TikTok, LinkedIn, X/Twitter, YouTube, Reddit, and Discord. Uh, which I don't have in the banner, but has been added recently because of our college initiative. The next tier up is you can sign up to volunteer. All this does really initially is get you into our Slack where you can take part in conversations there and figure out what interests you or how you'd like to get involved. You can apply for a position. We have a fairly robust wholewashington.org/jobs page. I will note that these jobs are not paid. However, some people like to know what they're signing up for. And if you check out this page, you might find some sort of position that is interesting to you. And maybe lastly, I don't remember, is donate to our cause. You can donate via Act Blue or Anodot. Any amount is really appreciated. Recurring monthly donations help us actually hire staff, keep people around, keep sustained expenses up. And why do I still have this here? We're hoping to have a merch store back within the month. Uh, but we don't currently have one, which is so frustrating for me because I really want whole Washington gear. I've been volunteering for 9 months, like pretty actively, and I still don't have a shirt. Uh, is Slack or Discord better for getting involved in the conversation? I'd say Slack is better. If you're really comfortable with Discord, Discord might be all right, but we have many, many, many more people on Slack. I want a bumper sticker. Yeah. If I had a bumper on my bike, I guess, I could put one on there, but, uh oh, we do have one more. Print our literature. Wholewashington.org/print is a really, really good page to bookmark, because this is where you can get anything that's really printable, like our one pager, like this handout, like quarter sheets, if you wanna go print them at the library and hand them out somewhere. Uh uh, this is a great source for that. Check in chat to see if anything has happened. And then attending an orientation. We already had our one this month, but keep your eyes peeled for the one next month. I don't know that I've seen it yet, but a volunteer orientation is going to be much more about what you can do within here, within our organization, and trying to connect you with the right teams that interest you.